Heroin and prescription painkillers are fueling a rise in overdoses around the country.
These are especially bad in rural areas where the nearest methadone clinic or addiction doctor may be hours away.
State of Washington, for the 5th year in a row, the number of heroin overdoses went up.
Suboxone is a medication that assists with opiate dependence. It's one of the rare medications we have in addiction medicine that's really effective.
When you're addicted to something, you think about it all the time. Suboxone fills the receptors that heroin or pain pills fill. People don't crave as much. And when they don't have their brain completely hijacked by thinking about this substance, they can get on with their lives.
Hi.
Hi, ma'am. Can you hear me okay?
Yeah, go ahead.
How would you describe your mood today?
I'm happy.
The Flex Care program is prescription-based. Suboxone is a medication that we can prescribe. It's allowed patients who are seeking treatment for their opioid use disorder to have better access to treatment. Many of our patients have full-time jobs or family responsibilities, and they can't come in and do daily dosing.
Well, ma'am, it's good to see you doing so well. We'll see you back in a few more weeks, okay?
Okay, thank you for your help.
Thanks again for
Telemedicine is very beneficial for all of our medical prescribers because they can access our program from wherever they are. But the majority of the care, the ongoing care, is through the nurse care manager.
We are sort of the eyes and ears for the doctor. We see the patients on a weekly basis and then sometimes every 2 weeks to every month, depending on their stability. We meet with the doctors regularly to update them on patients' progress. So it really helps to maximize doctor time.
Started partying when I was pretty young. Started getting into pain pills when I was about 20. And then it got to where I was eating like handfuls of them, 5 or 6 at a time, every couple hours.
Blood pressure was 126/72.
Try to quit, and then I would just be so sick from withdrawal. There was no thinking or even trying to think about anything else,
And he's a follow-up. This is his quarterly visit.
You spend most of your day driving around looking for him, and then by the time you find him, it's too late to go to work or anything, so, it's just that ongoing cycle. That Suboxone finally ended that cycle.
So, any concerns at all about Suboxone or about the program at all that we can help you with?
No, not really. Everything's pretty good.
Really, things are coming together well for you.
Yeah.
Our patient population up to this point has been growing by about 10 patients every month. But right now, we're a little bit at a standstill because of our staffing.
The waiting lists for getting into a Suboxone program are really long because there aren't enough docs who've stepped up to do it. The training is a snap. The hard part is to have somebody mentor you.
Thank you.
Have a good day.
At ETS, physicians who may not have much experience in Suboxone treatment can feel very comfortable that they're being supported and guided through this process. If things change and the patient needs more help, even to the point to where they need daily administration of the medication, it's something that's offered at ETS as well.
If I get saying that way, then I'm like, oh, I got hurt. Look at me.
I tell doctors who are thinking about learning how to do Suboxone that it really is one of the most satisfying parts of my job. It's not that often that a primary care doctor can clearly think to herself, I'm saving a life today.
I went from living in my car to my own place now. I got my own job, and now I got a family. It's awesome. It's a whole 180 from where I was at. If it wouldn't have been for Suboxone, I don't know where I'd be. I'm very, very grateful that I found this place when I did.